My name is Dr. David Newell, and I'm one of the two executive directors of the Swedish Neuroscience Institute. I'm originally from a suburb of Boston, Massachusetts, Acton, Massachusetts. I decided to study medicine while in college at Boston University and took the opportunity to attend Case Western University in Cleveland, Ohio. I became interested there in neurosurgery and came out to Seattle to train in the neurosurgery training program at the University of Washington. I was there at the University of Washington for 22 years and ended up as a professor of neurosurgery and the chief of neurosurgery at Harborview Medical Center. I decided to come to the Swedish Neuroscience Institute because of the commitment to build a world-class neuroscience institute in Seattle that was comprehensive in its scope and promised to install the best equipment and facilities available for treatment of neuroscience patients. Dr. Sanford Wright's the director of the Everett Neurological Center. Many know Dr. Wright. He's been in Everett for many, many years and has been a very well-known physician who's dedicated a lot of time and effort to the community there. He's well known for his neurosurgical abilities and has recently been able to create a center to elevate the level of treatment by integrating multiple practitioners in neurosurgery to come together and discuss various complex problems. Taking care of cancer patients can be quite complex because of the multiple treatments that they may need. Some of the treatments include surgery, followed often by radiosurgery or radiation therapy, and then also chemotherapy. Treating patients properly and up to current standards requires a team approach with input from many physicians as well as radiation therapists and surgeons to make sure the patient's getting the best treatment. So it really requires a community of physicians to make sure the patients are getting the best treatment that they can. One of the advantages that we've seen in the collaboration between the Everett Center and the Swedish Center in Seattle is that we can discuss each case and determine what combinations of treatment are the best for each patient and where they should get those treatments. It improves the level of care for patients because it makes many more options available to them, including access to the most modern equipment as well as access to genetic analysis for their tumors, access to the most current trials in chemotherapy or medications for different tumors. Clinical trials can be a big advantage to patients. Often when a new drug is introduced for a treatment of a tumor or cancer, the patients are entered into clinical trials first, and this is the setting where the patients first receive this new treatment for a particular tumor. So they're able to be enrolled in a clinical trial if a new promising treatment is available for a particular type of tumor, and the patients may benefit from the trial if the medication is effective. We currently have a wonderful collaboration between the Providence Regional Medical Center and the Swedish Neuroscience Institute. We closely collaborate on discussing complex cases and are committed to getting the patients to the right treatment facility for their particular individual problem. The patients that can remain in Everett for their treatment do so, and patients who are better served by coming down for subspecialty treatments such as complex epilepsy, complex cerebrovascular problems are treated down at the Swedish Neuroscience Institute in Seattle. My clinical interest has been in neurosurgery, particularly cerebrovascular neurosurgery. So some of the cases that I become involved with include aneurysm patients, patients with arteriovenous malformations, patients who need carotid endarterectomy surgery, and patients with cavernous malformations. We have a cerebrovascular center and a management team which includes Dr. Joe Eskridge in interventional neuroradiology. Dr. Eskridge is an extremely experienced interventional neuroradiologist and has a vast experience in embolizing AVMs and coiling aneurysms, placing stents in cerebral arteries, and treating other cerebrovascular lesions. Dr. William Lakowski is a stroke neurologist who has a tremendous experience in treating stroke patients and setting up protocols for the most advanced stroke treatments in the Northwest. We've been very fortunate that Swedish has installed state-of-the-art equipment for treatment of cerebrovascular lesions. This equipment includes a state-of-the-art interventional suite, which has a biplane angiography and interventional treatment unit specially designed to embolize tumors, embolize AVMs, and place coils and stents in aneurysms and other cerebrovascular lesions. We also have state-of-the-art operating rooms with special sophisticated equipment for performing complex surgery on cerebral aneurysms and arteriovenous malformations. The Swedish Neuroscience Institute also includes a CyberKnife, which is a radiosurgery apparatus that uses directed beams of radiation to target arteriovenous malformations and other lesions. The CyberKnife treatment is effective for deep-seated arteriovenous malformations which can't be treated in any other way. It's also used for benign tumors such as meningiomas of the skull base and other lesions. The advantage of CyberKnife over previous radiosurgery equipment such as Gamma Knife is that the CyberKnife can treat lesions in the spine as well as in the cranial cavity. Patients with cerebral aneurysms can present to medical attention in several different ways. They can present when an aneurysm ruptures, which is what we don't like to see. We would rather try to detect the aneurysm early and get it treated before it ruptures. Once it ruptures, however, we still have excellent results if the patients are in good condition by either coiling the aneurysm or treating the aneurysm surgically by clipping. This prevents the aneurysm from rupturing again and causing a potential fatal hemorrhage. Aneurysms can also be discovered incidentally if they are picked up on a scan, or if patients present with pressure symptoms such as aneurysms enlarging and pressing on nerves that go to the eyes or other structures in the head. Patients can also, can you edit that? Yeah. Patients can also present with pressure symptoms when aneurysms press on nerves that go to particular structures in the head, such as the eyes, and these symptoms could include double vision, focal headaches, and other pressure symptoms. When the imaging study reveals an aneurysm in this situation, we take the patient for treatment as soon as possible, and this could include surgical clipping. It could include bypass in some complex aneurysms, and it could include stenting and coiling of the aneurysms through catheter-based treatments. Postoperatively, if the patient has a clipping or a coiling of the aneurysm, they're cared for in a specialized neurosurgical intensive care unit, which has the capability to measure blood flow in the brain, to measure Doppler examinations of the cerebral arteries, and other important assessments in patients that have had aneurysms treated.